Come on in, you guys. We're getting ready to start another Jimmy on Clubhouse. And I have a really fascinating conversation today with Brian O'Halloran. He is a pharmacist. That's that gentleman right there. He's a pharmacist who loves keto. And we got to talking a little bit, and he talked about how there are certain contraindications for people taking medications while they eat a ketogenic diet. It doesn't mean keto's wrong. It just means keto's healing parts of your body that you're taking the medication for, especially those of you that are type 2 diabetic. Listen up. Hello, Norma. Thank you for being here today. I'm glad that you joined me on the new show that I do on Clubhouse. And one of these days, they're going to open it up, Norma, for everyone to be on Clubhouse. But for now, this is Jimmy's way of fixing that problem of not being able to access the information there. And it's a lot of great information there. So let me go ahead and start the room. And here we go. Coming in, guys. We're getting ready to start a brand new Keto for the Soul room. And we're going to have Brian. I see Brian. What's up, Brian?
Hey, Jimmy. Can you hear me okay?
I hear you perfectly fine. Come on in, guys. We're about ready to have a wonderful conversation with this gentleman that's here next to me on the screen. Appreciate you guys being here. We're going to talk all about a topic that I don't think anybody else is addressing right now. So I'm really glad that we're going to talk about this topic of when you go keto, there's certain things that happen that might require you to be mindful of the medications you're taking. So I have this wonderful pharmacist friend of mine, Brian O'Halloran. Say hi, Brian.
Hey, how you doing? Thank
Hey.
you for having me on.
Yeah, man. So he goes by the moniker, the Ketogenic Pharmacist. I remember when you and I first started talking, Brian, I was like, wait a minute, that sounds like an oxymoron. How are you both for a ketogenic diet and I suppose for medications? But after talking to you a little more, I realized, okay, there are certain even medications that are still pretty good for people. It was cool to kind of learn from you. And I said, we need to talk about some of these drugs, especially like the diabetes drugs that patients are on. And how they can be problematic in the doses that you were on for when you were a carb burner, that when you switch to sugar burn or to fat burning and produce ketones, totally changes that need for that medication. So excited to get into that here in just a moment. Let me go ahead and set the room. You are in Keto for the Soul. Click on that green house at the top of the page right next to the name of the room. And you can subscribe, join. I am a huge fan. I'm on here literally all day long and doing my own content like interviews like I do here, but also being in other rooms. So highly encourage you guys to check out Keto for the Soul. My name's Jimmy Moore. I am a 15 plus year veteran of podcasting. And so when Clubhouse came out, I said, well, one thing I can do is interview people. And I've got a lot of friends in the world of keto and health and just interesting people. So that's what I try to do, is bring those people here to you guys in kind of an interview format. I do want you to participate. So if there's anything interesting that you hear us talk about, go ahead and raise your hand. Hit that little hand button at the bottom. I see a lot of party hats. So if you're brand new to Clubhouse, that hand at the bottom when you want to speak, that's how it alerts me that you want to, and I'll pull you up on the main stage and we'll have you ask your question, give your comment, whatever. But Brian is a pharmacist and does implore a ketogenic diet. He's going to be a guest on the Live and La Vida Low Carb Show. That's my podcast on Wednesday. He and I had a nice conversation just a couple of days ago, and so we would love for you to listen to that. Kind of gets into your story, Brian, about why you believe in keto now and everything. But today, I want to hyper focus on this idea of what happens when you eat keto and why your med needs change. So do you want to kind of give an overview?
Yeah, absolutely. So, where do we start? Okay, so when we talk about ketogenic lifestyle, and by the way, I like to call it a lifestyle because saying a diet means, when I hear the word diet, I think of failure, because a lot of diets do fail. I think of ketogenic as a lifestyle where it's something you grab onto and you utilize it for a long term. But when you are going into a ketogenic lifestyle, a lot of what happens is that you obviously are going to be decreasing your carb intake. That's number one. And if you are on medications like that, in which doctors do prescribe, obviously, if you have a metabolic condition, diabetes, high blood pressure, when you are adapting to this lifestyle, you are going to be noticing that your blood pressure is going to drop.
Yes.
You are going, yeah. And it can be very challenging and scary because all of a sudden, if you're taking your regular medications as prescribed,
Yes.
and if you if you start going down the road of ketogenic lifestyle, which I think is a great lifestyle to go down, but you have to be in constant contact with a pharmacist and a doctor.
Yes.
Your whole entire healthcare team, because you can run into a lot of trouble if you don't adjust medication.
So, Brian, I'll give you a real world example in my own life. When I started on the Atkins diet in 2004, I didn't know about any of this. And I went on the Atkins diet, was ostensibly getting into at least a fat adaptive, if not full on keto adapted state. And within 6 weeks, I would get up off my couch and I would black out. It would just go black, and I'd have to like brace myself for about 10 seconds, and then finally I'd come back. And I realized it took me a few episodes like that before I went, what am I doing? Oh, I'm still taking this blood pressure medication. I was still on a statin drug for high cholesterol. This is before I educated myself. I was on that high blood pressure medication, and then I was also on a breathing medication for wheezing. The wheezing one went away real fast, like within 4 to 6 weeks, I'd stopped wheezing. But then the blood pressure one, I didn't immediately notice it, and that freaks people out. Like, they just think, oh no, keto caused, or whatever diet they did caused them to start blacking out, when it wasn't keto at all. It's you're over medicating a problem that's not a problem anymore.
That's exactly right. And you got to really, it's not one focused thing. It's a whole entire big picture. And obviously with the medications and, with the diet changes and yeah, absolutely. So, and it happens pretty quickly too. So you really got to everybody has to be on board and be ready to go here when you are adapting to a ketogenic lifestyle, because these changes happen pretty quickly.
Yeah, 3 months ago, I got a DM from this lady on my Instagram page, and she said, keto is unhealthy. And I'm intrigued. Tell me more. And so she's like, well, I'm a type 2 diabetic, and every time I eat food, I go into a major hypoglycemic episode. And that's not healthy. That's going to kill me. I need to eat more carbs. So I said, call me. So she calls me on the phone, and I start asking her probing questions. And you know what she was doing, Brian? She was still taking the same bolus of her diabetes medications as she was before, which included a fast-acting insulin. I said, sweetie, you don't realize keto is a drug, just like a drug, to heal those parts of your diabetes that you're in your carb burning state had to be taking medications for. Now keto's your medication. So I said, I can't tell you what to do. Definitely do what's right for you and consult with your physician. But if I was you, I would stop the fast acting insulin and just see what happens. And do you know, her blood sugars were completely normal. She felt great. She's like, oh my God, why did nobody tell me about this?
This is by the way, this is something that goes back to the whole point of food is thy medicine. This is what we're doing here. Instead of actually, taking these medications, we're actually treating these conditions with food. I mean, how awesome is that? And that's right. People don't realize that. Obviously, if you got to really be mindful of these, insulin, boluses and the actual oral medications. These all have to be adjusted, and I'm hoping that as time goes on, more doctors will realize that, this is something that I know they're taught in medical school, that we got to prescribe medications and we got to treat these, these conditions with X medications. But if we take a step back and start going to the root cause and looking at the diet, these medications may not be necessary. Obviously, some medications are required for certain situations, but overall, to treat chronic diseases, a lot of these medications can be eliminated if you adjust your diet accordingly.
Yeah, and I see Dr. Phillip just popped in to the room. Hello, Dr. Phillip, and I definitely want to get your comments about this if you want to pop up to the top. Statin medications are so pushed so hard, and a lot of keto people say, well, I want to take a statin because I know it's going to raise my LDL and total cholesterol, and my doctor is freaking out about those numbers. So while I eat keto, I'll go ahead and take this statin to try to lower that and prevent it from going super high. Can you talk about why maybe that's not a good idea?
Oh, yeah. I mean, the thing is, first of all, when you're talking about cholesterol, when you're dealing with statins, there are a lot of side effects, and I hear it all the time because I counsel patients on a daily basis, and oh gosh, most of them, and I obviously I can't give a percentage, but most of them that are taking statins, they develop side effects.
Yes.
Yeah, and the muscle pains, the muscle aches, they feel like crap.
I had it.
They really don't.
Yeah, I had muscle and joint pain galore, dude. I remember because I was on Lipitor. This is all before keto. I was on Lipitor for about a year, and I was just suffering. When did I go on Lipitor? It was in my late 20s, somewhere around 27, 28 years old, and went on it, and I felt like an old man, like instantly within just like not that long. And so I'm like, oh, wow, I guess this is what getting older feels like. And a lot of people with these kind of drug interactions, that's how they justify it. They go, well, I guess this is what you're supposed to feel like. Everybody else in my life, when they reach a certain age, start to feel those aches and pains. Aches and pains are a sign of distress in your body. Like, I wish we could kind of break free from that. And when you kind of eat a ketogenic diet, lower inflammation, put your body in a much healthier position, it rewards you with mostly pain-free and working optimally.
That's exactly right. And we're chasing these with doctors that prescribe the statins, and they have to, they are encouraged to with they've got certain metrics they have to reach,
Yes.
to meet. And especially the patients with diabetes, oh, you have to be on a statin, and it's just, that's what it is, and there's no ifs, ands, or buts. And if they don't prescribe a statin, I think they get deemed with certain metrics. And so it all comes down to with the doctor's ratings, and they have to do what they have to do. And I understand they're kind of put in a position, but boy, it's a kind of a big mess, to be honest with you, because there's a lot of moving parts that are involved in this, between the drug companies that are pushing this, the people that design the metrics, and we're missing the big picture. And that's where I come in to help with getting back to the root cause of why we were in this position to begin with.
Yeah, and it's amazing that they come to see you and all of these patients so obediently. And I suppose there is some white coat syndrome that goes into that, where people go, okay, well, they're wearing a white coat, they must know everything, this must be the right thing. And it isn't. And I'm not anti-doctor. I love doctors. We've got a couple of them here in the room today. And I think they do a wonderful job with what they're good at. And what they're good at is acute disease. When someone's in distress, getting them out of that medical distress, medical emergency, broken bone, laceration, those kinds of things. But when it comes to chronic diseases, none of these drugs that are used to treat diabetes, which is treated like a chronic disease, high cholesterol, treated like a chronic disease, all of these drugs that become maintenance drugs that were never intended to be on, for you to be on for the rest of your life.
Yeah, exactly, and you're absolutely right. I've got the utmost respect for doctors and everything that they do. But you're right. These conditions that we have, that they can easily be treated with diet. And I just and the thing is, when I talk to my patients on the phone with, because I still work at as a pharmacist with my day job, I should say. I'm trying to, obviously I can't go against what their doctors say. And that's something that, I'm not trying to pit the patient against the doctor, but I want to give them the education that, hey, if we go down this road with diet and, focusing on eating the right types of foods, maybe we can get off these chronic medications. And, sometimes you get the pushback, and you have to, it's a very difficult position, but I'm hoping that as time goes on, we realize that this can be done. And we're getting back to the statins. I mean, all we're doing with these statins, I know that's kind of a hot button topic, and as far as prescribing the statins and using them, but we're doing is we're chasing that LDL marker, which we have to look at the other markers. We got to look at the ratios, and yes, the LDL plays a role, but a very minor role, but we're treating it as the role in prescribing these statins, and I don't think that's right.
Well, and the problem is it's been that way for decades. LDL, chasing LDL, and to a lesser degree total cholesterol, and LDL being an estimated number. I've talked very extensively about the cholesterol stuff, but these statin medications, they even shifted the messaging when they found that people were still having heart attacks, even though they were on a statin medication. They were still having angina and other issues despite taking this medication that was supposed to be a prevention. And the problem is, like you said earlier, doctors have these standard of care guidelines they have to follow. They get dinged. They have issues with the medical board if they don't follow those things. If the patient has a heart attack and wasn't prescribed a statin, then they can be sued and da-da-da. Man, it's just such a, patients have no idea all the things that go into why these medications are promoted to them so heavily.
Exactly, and what's even to kind of follow up on that, the most of the patients that I talk to, a lot of them are in the elderly population. I'm a geriatric pharmacist, so I focus on the geriatric population, and I'm having patients that are in their 80s that are still on 80 milligrams of atorvastatin.
Yes.
And I'm like, what are you doing? What's the purpose of this? And it's like, I mean, I know that the doctors are trying to do the right thing, but when we're in our 80s and what's the main deal? What are we trying to do here with the statins with somebody who is in that age group?
Yeah, it's actually a lack of education ancestrally. I remember when I wrote Cholesterol Clarity, in there, one of my experts was Dr. Chris Masterjohn, who's pretty much into lipidology pretty heavily. And he said, did you know in traditional cultures free from heart disease, women in their 60s, 70s, and 80s, their normal cholesterol was 300. And so here we are putting all these poor older ladies like the one you just described on these medications to lower cholesterol at the very point in their life when they need more cholesterol. I see Dr. Rebecca just popped into the room for hormone control. Like, there's so many good things that happen why you want higher cholesterol, especially later in life, that when you're artificially lowering it, then it starts popping up with symptoms of Alzheimer's disease, definitely. But then they just say, oh, they're getting older. That's what happens when you get older. You just develop these chronic conditions that it's inevitable, and it was the drug all along.
Jimmy, you hit a point with the Alzheimer's and memory. I mean, that is a huge thing that I come across every day when I talk to my patients, especially the elderly patients that are on these statins, and they're forgetting things. They're just attributing it to, oh, this is it. I'm getting older. But cholesterol is important. It's essential. I mean, your body, if you get low cholesterol, your body will make it. It's something you have to have cholesterol in order to live. And there's so many things that happen when you have cholesterol in the body. And when we're messing around with that, there's so many the consequences. There's so many unintended consequences that can happen, such as like the memory, forgetfulness, the muscle pains, and everything that goes along with that.
Yes. So I'm going to reset the room. You are in Keto for the Soul. Click on that little green house at the top of the page, and you can subscribe and join us all day long. We do these pretty much 24/7, 365, and we have a good time. I go in a couple of times a day and do my thing. I'm a longtime podcaster for 15 plus years. And so what I know how to do is interview people. So I have my wonderful friend, Brian O'Halloran, today. He is a pharmacist who actually became enlightened about the ketogenic diet. And so he and I actually have an interview coming up that will be airing on the Livin' La Vida Low Carb Show, my podcast that airs on Wednesday. So this coming up Wednesday, go listen to that interview. But today I wanted to focus in on this topic of keto and meds. So ask your questions. I am simulcasting as well over on Jimmy on Clubhouse Instagram page. This is the live simulcast of what happens on Clubhouse, because not everybody has an iPhone or has an invitation to come. I hear they just reached like 12 million subscribers now here on Clubhouse, so I try to open it up a little bit more and let them see what's going on. But Ruth had a question over on the Instagram page, Brian, and then we'll get to Sarah and Leah and anyone else that wants to lift your hand. I will pull you up here in just a moment. But Ruth from Iowa, thank you for it. She said, what are your suggestions if I'm on medications for Parkinson's disease? Because I'm assuming there's some conditions where even if you eat keto, you might still need those medications.
Yeah, absolutely. So yes, that is something that you definitely should be obviously talking to your doctor about. But one of the things that I've noticed with, again, when we're getting to the Parkinson stage, I mean, it's difficult because I think obviously a ketogenic lifestyle can definitely be beneficial, and you may be. I think when you adapt to that and you get into the keto, when you have a ketogenic lifestyle, you possibly can be doing better with the Parkinson's. This is something that everybody's different. It's hard to say, but I think that definitely be definitely beneficial by doing that.
There have been some studies when I was doing my research for Keto Clarity. There have been some small studies looking at Parkinson's disease, and what they tried to do was mimic the epilepsy diet. So this is a very high fat, very kind of lower protein, and obviously extremely low carb. It's a 90-10, 90% fat diet, 10% combined protein carbohydrate. And so that's the epilepsy diet that really helps to be very therapeutic, produce very high levels of ketones. I don't think you necessarily need to do that anymore, Brian, because of these ketone esters and exogenous ketones. You might be able to have them eat a more traditional ketogenic diet, but then add in these things to boost the ketone levels to see the therapeutic effects.
Yep, exactly. So the keto esters that you refer to, I think that those definitely have a purpose in these situations, and especially when we're dealing with brain situations with the Parkinson's, the epilepsy. This can definitely help get those ketones up. Follow a ketogenic diet. You don't have to. I mean, to be honest, that the epilepsy diet that you mentioned, it's difficult to follow.
Yes.
It's
very gloppy.
Not exactly easy. Yeah.
It's very gloppy and fatty, and it's unpalatable. And the interesting thing is they try to feed it to these very young kids with epilepsy, and they're like, "Mommy, it's so gross. Ew."
Yeah, it's difficult. But these ketone esters, I don't think they're good for everybody. But when these situations, when we're dealing with brain disorders such as Parkinson's,
yes,
epilepsy, absolutely, yeah. I think that's a great idea.
So before we get to the people up on the stage, and again, you guys, raise your hand if you want to come up on the stage and ask the ketogenic pharmacist a question about keto and meds. But let's hit diabetes, because this is a biggie. There are so many people on metformin, and I think that's one of those drugs that if you're going to take a drug for your diabetes while eating keto, that's the one, because it's going to only make keto work better. Now, obviously, the goal is hopefully to come off of it someday and improve your insulin sensitivity naturally, but that can actually help coincide with what you're doing with your ketogenic diet, but then the fast-acting insulin and some of these other drugs. Can you identify some of the drugs that could be problematic if you go keto and then you still stay on those drugs?
Yeah, the one that comes to mind, well, first of all, insulin, number one. I mean, that's something that we really got to, this has to be adjusted pretty much immediately when starting a ketogenic lifestyle. But some of the other medications that you have to kind of think about too are the flozins, the ones that, Flozin,
Yes.
flozins, like Invokana, Jardiance, Farxiga. Those are the brand name medications, the SGLT2 inhibitors that people take to. What they do is it helps you pee out the glucose. What happens when you're on those medications and adapt to a ketogenic lifestyle? You can get normal glucose levels, but you can also develop DKA and diabetic ketoacidosis, and that's obviously a very serious medical emergency that has to be treated like immediately. And there has been some studies, and in fact, I think the FDA put out a warning with those classes of medications that that can happen. You can develop the euglycemic DKA, and it's an interesting phenomenon that happens. But those medications, along obviously with the insulin and also like glipizide, the ones that when we're talking about the diabetes medications, glipizide is another one that you really have to be careful of when we're doing a ketogenic lifestyle, because your insulin, your when you're doing a low carb, obviously your insulin's going to be lower, and then if you have medications that stimulate the insulin production, such as the glipizide, because the glipizide kind of works on the pancreas that pumps out more insulin, you're going to get into a problem. You're going to get into a lot of trouble with low blood sugars.
Yeah, low blood sugars and then an elevation in the ketones, which in the context of nutritional ketosis is okay, but in that context can be dangerous.
Absolutely. Yep, exactly. So there's a lot of moving parts, and that's something where I come in to look at the whole entire medication profile and make the recommendations. Obviously, I can't tell you to stop medications. Obviously, this is something that your doctor has, and I fully respect that. The doctor is the one that has to be the one to make the medication adjustments. But I'm here to help facilitate that discontinuation or reduction of medications.
And this is why I think so many people are gravitating to functional medicine doctors and naturopaths and even a lot of these low carb, ketogenic, carnivore types of doctors. They are out there, you guys. Go on dietdoctor.com. I know they have a list of physicians, and a lot of them are here, really fabulous people that can help you adjust those medications appropriately while you go keto. So there's no sense in trying to do this willy-nilly on your own. If you're on medications and you're on keto right now, please be under the care of someone that can help you. Brian, do you offer kind of a service for patients that want to get some help in that way, or do you point them to their local physician?
Well, I can. What I do is I make recommendations, and and this is something that I'm not just a rogue pharmacist that says, hey, stop all your medications and just that is not responsible. But I am the one to help facilitate that discussion and help make recommendations. And I'm the ketogenicpharmacist.com. I can help you adapt a ketogenic lifestyle with also being mindful of the medications you're on and doing this safely. So that's where I come in.
Yes.
That's what I'm trying to help people do is to get off medications safely with obviously the doctor, with help with their physicians and obviously with me as a pharmacist.
You are the first nutrition-minded pharmacist I think I've ever met. Not that there aren't others out there, but you're out there. You literally call yourself the ketogenic pharmacist. It sounds like an oxymoron, but no, it's a thing.
It is, absolutely. And by the way, I've got 20 years of pharmacy experience. So like I've seen it all between retail pharmacy, consultation pharmacy. I've been around and I've
Yes.
seen a lot of stuff, and this is why I've completely. And by the way, you asked me 20 years ago. I was all gung ho about medications and getting the latest one and asking your doctor about this medication for X, Y, and Z. But now I have completely switched my tune, and I'm the one who's going to tell you, ask your doctor about getting off
Yes.
this medication. I've completely switched my tune as far as when I first started 20 years ago.
It's not a good business model economically, but from an ethical medical standpoint, dude, you should be very proud of what you're doing now.
Thank you. I appreciate that. And that's exactly why I went to school. This is exactly why I became a pharmacist, is to help people. I'm not looking at this as a money situation. Maybe I'm stupid for not doing that, but these are people's lives we're talking about. And, I just, it strikes a chord with me, and it's a passion of mine, and it's 100%, I'm all for that.
And you told me in our interview, and then we're going to come to you, Sarah. You told me in our interview that's coming up on Wednesday's Living La Vida Low Carb show that when you went through schooling, I said, did you get any kind of education on the effects that food would have on medications and any of the metabolic pathways? And you're like, nope, it was all pharmacological, just what the drug did, food or no food.
Yeah, exactly. I was going to make a joke and say, let me count the number of years that we talked about nutrition. 1, 2, carry the 5. 0.
0. Yeah.
There was nothing, and I had to do this on my own. And by the way, there's a lot of information out there, and to suss out all that information, and it's just one of those joys that I have, and just to get as much information as possible, and learning and listening, and following people like you, and 9 books, Jimmy. Just amazing stuff. So there's a lot of information out there, and awesome. So yeah.
I think the Ketogenic Pharmacist book is down the road, brother. When you're ready to do that, I'll help you out. So
I'm ready.
Yes. All right, we're going to go to the questions now, guys. Raise your hand. Hit that little hand button at the bottom if you want to pop up to the main stage. We'll let you ask your question, make your comment. Sarah, you're on deck. What you got?
Okay, hi. First, I've never spoken in this forum, so
welcome.
I hope I'm doing it right.
Welcome. You're doing well.
Thanks. Okay, so I have type 1 diabetes, and I've been following a ketogenic diet for 3.5 years. And since I have type 1, that, for anyone who doesn't know what that means that it's an autoimmune disease that kills the insulin-producing cells in your pancreas.
Yes.
Which means that I will always need insulin. I'm
That's
not
right.
going to be one of the people who can use diet to avoid insulin.
That's right.
But I can use less insulin, and
That's
I
right.
do.
Yep.
I was wondering, because there's a lot of resources about keto and type 2 diabetes, because it can be treated with keto diet. There's not a lot out there for people who have type 1 diabetes and are following this lifestyle. And I was wondering if there is a specific basal insulin that is better in general. I know you can't advise on me, but if there are, if one of the basals is more suited to a ketogenic diet than the others.
I'm not familiar with a specific basal insulin that is better suited for ketogenic lifestyle. And by the way, being a type 1, a patient with type 1 diabetes, do you follow, as I believe, Dr. Richard Bernstein?
I follow his diet modified. Like, for instance, I think he's kind of over the edge on some things. Like, he says you cannot have yellow bell peppers, only green and red. And I think that's kind of crazy. So I don't follow him strictly. But very close. I would say I eat less than 30 grams of carbohydrate per day.
Nice.
I would also offer the name R.D. Dykman if you've never seen his work before. He's primarily on Facebook with his work, but he's done a lot of research on type 1 diabetes. There's a lot of us out here, I say us, colleagues of mine in the online world who talk about it. So definitely, Sarah, hit me up on Instagram if you'd like a list. I'll give you all kinds of people that you can connect with. There's a lot more resources than you realize.
Thank you.
Thank you. Leah, you're up next.
Hello, my name is Leah. I am an American Canadian, but live in Norway, Scandinavia.
Nice.
Yes.
Great.
Yeah. So, I about 3 years ago, I started something called Bright Line Eating, where I totally stopped eating both flour and sugar and everything. A little bit down the road, I thought that was a little bit. It wasn't the lifestyle that I knew that I could live with. So about 4 months ago, I started on keto. And I started talking to my doctor. I was sort of relating to what you guys were talking about because I started measuring my blood sugar and everything. And I was kind of on the border, on the bridge of getting diabetes. So I talked to my doctor about pre-diabetes. And maybe it's because we're in Scandinavia. I don't know. Maybe it's like that in the States. But she sort of looked at me with a question mark and was like, well, either you got it or you don't.
Wow.
And I said, but I've read a lot, and I think what I've done up until today is, I think if I hadn't done those changes, I would have had diabetes today.
So,
and she says, well, we sort of say, if you have it, you have it. If you don't, and I talked to her about metformin because I use a painkiller patch, morphine because I have problems with my back. And I've been having some extra pains in my joints. So I said, could some of these pains come from me being on the bridge of getting diabetes? And I've been several places here, and people are like, they look at me like I'm kind of nuts. No, we don't. No, we haven't. So, but because what I have seen has been the past 4 months, I'm sleeping better. I actually have to be honest and say I haven't gotten the energy levels, the clarity that people are talking about. And my weight loss, which I really, really want to do, is going extremely slow. And I'm like under 20 grams of carbs every day. I've read, I've checked off all the lists of the do's and the don'ts and everything. And I'm doing sort of what I'm supposed to do. It's going down little by little, but I'm sort of wondering, is there any sort of because my doctor won't give me metformin because she says I said, okay, does this mean that I have to get diabetes? And when I do, then you'll give it to me? She says, yes.
That's nonsense. That's crazy.
So that's here in Norway. So I can't really do anything about that. But actually, I just need some reinforcement as to, because I feel like I'm doing the right thing, but it's going so slow, and I'm not getting the results I really thought I would get, but I'm not going to give up. Absolutely not, because this is a lifestyle I can live with.
Leah, how old are you?
I'm 58.
Okay, so she's a little bit older, Brian, and I know it gets a little bit harder postmenopausal.
Right.
Are you on any medications, Leah, specifically, besides the insulin for your type 1?
I use a painkiller patch on my back because I have real big back issues.
I got you. Brian, can painkillers, is it an NSAID? What's the name of it?
I don't. It's a Norwegian name, so I don't think you would recognize it. But it's like a painkiller patch on my back that I change every week.
Brian, are you familiar?
I was going to ask you. Do you know the active name or the active drug that you able to look that up for me real quick?
Well, it's morphine. It's a morphine based patch.
Okay, so are we talking about like Duragesic, which is like a fentanyl-ish? Yeah, it's fentanyl, but I mean, is that something like a class 2, schedule 2 narcotic?
Yeah.
Okay.
That could be the weight thing.
Yeah.
Could that be the thing that's sort of slowing everything up? Because I'm sort of at my wit's end when it comes to, and like I said, I'm not close to giving up at all. This is a lifestyle I can live with, and I have no problems living on it. It's just that I would really like to find sort of that key to it really working extremely well for me. Because I'm in ketosis. I measure my blood. I measure everything. I've been in ketosis now for 4 months.
Okay.
So, Leah, define extremely well. Are you just throwing all the eggs in the basket of your weight, or are you looking at some of these other subjective and even pathological markers in your blood? How are you defining that?
Well, doing extremely well for me would actually mean that my weight loss would be more than it has been
Okay.
until now.
Gotcha.
But I'm not putting all those eggs in that basket because I know that it's so many other things. I'm sleeping better at night, which is great for me.
Yay.
And I would also like to have this higher energy because, of course, when you have a lot of pains, I can struggle with not having, an abundance of energy, as you probably know.
Yes.
Yeah.
But
sorry, I'm gonna just to chime in here just for a sec. So with these pain patches, I mean, how often do you change them out? Like, is it
once a week?
Once a week, okay. So you're going to get a lot of the narcotic, that's in your body for a long period of time, obviously, because you change the patch once a week, so you have a constant level of pain medication in your body. And with the energy, when you're taking pain medications, you're that's number one. Your energy is not going to be as abundant as if you weren't on the pain patches. So I'm wondering if you can maybe ask your doctor about, and this has to be done very carefully, about switching over to something that's you have to maybe like a tablet or something, like an oral medication, kind of switch off the long acting pain medicine, going to more of a shorter acting and kind of very gingerly getting off of that, because when you're dealing with ketogenic diet, it's kind of an anti-inflammatory diet, and it's going to help reduce the way it operates. You're going to be reducing pain that way. And I'm wondering, I'm just kind of thinking out loud here, maybe we can ask your doctor about maybe switching over to a more of like an immediate release, or kind of a oral medication, tapering off that way, and maybe your energy levels will go up with your pain going down, because you're in ketosis right now. And I'm wondering, I'm just kind of thinking that route.
That could be, but I don't think I've been doing this for 10 years, and I think what the ketogenic diet has helped me to is not to increase that. I don't want to increase the level of what I'm taking right now. And I think that is, I've avoided that by what I did 3 years ago, starting to just avoid all flour, all sugar, all of that. So I don't know exactly, because I've tried other stuff and it's really hasn't worked a lot for me, and it's ruined actually a little bit more of my quality of life. So, but I'm just, have you, because you guys work with people all the time that are on keto. Do you see often that people that it really, really goes slow? I mean, that I could maybe use a year before I see really good results?
Well, let me ask, I want to just go back to what you just said just a minute ago, and I want to just double check on something. So you said you've tried other modalities for pain, and were you doing these other modalities while on ketogenic diet, or was this before you did ketogenic diet?
Oh, that was actually before.
Yeah, so I'm wondering if we can kind of reconsider that again now that we've switched over to a ketogenic diet. I'm just thinking out loud here. Obviously, this is something that it's a very complicated situation. Obviously, you've been in these. You said over 10 years, so this is something it's a chronic pain condition. But I'm wondering, now that you are on a ketogenic lifestyle, I'm wondering if we can revisit that again. Just a thought.
But you have seen that the medication does affect, because for me it's just that if I just know that somebody else has been in the same situation, that it's going to take, if somebody told me it's going to take a year and then your body will kick in, then it's sort of easier to, I don't know, it's something psychological, that it's sort of easier to handle and easier to because I like what I'm doing now, but it's just it's a little bit frustrating.
Yeah. Obviously, make sure that your electrolytes are up too. I mean, that's one of the things when you're kind of sluggish, and we got to make sure that you're making sure you're eating enough salt. Are you doing that?
Yeah, I take the salt. I make Himalaya salt because there's a lot of things we can't get over here. So I've also bought from the States actually exogenous
ketones.
That's what it's called, ketones. But then there's been discussions, does that help? Doesn't help because it's really expensive for me to import them here. Which type to use. It's been, I've been back and forth on that. So actually now I'm in ketosis and I don't use anything extra. When I take, I put lemon up into water and pink Himalaya salt. That's what I drink every day.
Okay, good. I just want to make sure that we don't disregard that, because that's super important when we're talking about when we're talking about ketosis, and we got to make sure that those electrolytes go up, because obviously when your insulin level goes down, you're going to be excreting, and you're not going to be reabsorbing the salt. We got to make sure that we replenish that, and you are doing that, so that's good. But yeah, I'm wondering. It's a complicated situation. I appreciate that, but I think I'm wondering if we can revisit with your pain management doctor about maybe just looking into that, because obviously when you're on pain medicine, you're gonna be feeling sluggish. You're gonna have the drowsiness, that kind of those kind of side effects, and I'm wondering if possibly we may not need as much as you're taking now. Possibly.
Yes.
So again, talk to your doctor.
Yeah, I will do so. So,
Leah, thank you so much. Did you have one more thing you were saying?
No, thank you so much.
Thank you.
Thank you so much.
Thanks for listening in all the way from Norway. That's awesome. I love the internationalness of this platform, Clubhouse. So she did bring up two interesting things in there that are also common drugs that people might be on when they start a ketogenic life. Weight loss drugs, things like maybe Byetta and other ones. And then the other one was sleep, which Ambien. I think everybody who struggles with sleep gets prescribed Ambien, and you're not getting the good restful restorative sleep that you want, and so therefore it's really counterproductive to the good things that are happening when you go keto. Any comments on either one of those kinds of medications?
Yeah, Ambien is that's a powerhouse medication.
Yes.
In terms of making you drowsy, and obviously that's there to help you sleep. But when you're not going to get that restorative sleep, and that's so important. And I'm going to kind of go a little bit step back here for a second. When you're embracing a ketogenic lifestyle, it's not just diet; it's everything else in terms of sleeping well, reducing stress, getting your vitamin D, getting your exercise. This is all encompassing. We can't just focus on diet itself. We have to look at the whole big picture.
Yes.
And one of the things is obviously the sleep. And, if we can get people off the Ambien, and what I do at night is I take magnesium. You have to be careful with the type of magnesium you take, because, some magnesium can make you go to the bathroom.
Citrate.
But magnesium, but you have a well-absorbed magnesium product, you can definitely get get a great night's sleep and kind of go down that road more naturally.
Yeah, there's so many things people just don't do, and they leave their lights on bright, and they're watching TVs and screens. They're throwing all this blue light into their eyes, and then they're just stimulated, not realizing they're kind of mimicking the effects of it being daytime. And then they go to lay down, and they're like, why can't I sleep? Gee, I wonder. Your brain is being told all of these ideas that you're not going to have bedtime anytime soon. My circadian rhythm is such that literally around 4 or 5 o'clock in the afternoon, I'm already getting drowsy. I'm already getting droopy. It's why I don't agree to interviews after like 3 o'clock, because I will be worse than toast at that time of day.
Well, yeah. What's the saying? Early to bed, early to rise. Something wise. I forgot the saying, but that's what you follow, Jimmy.
Yeah, I'm up way too early though. I was up at 2:15 today, but I go to bed at like 7:30, so it's
There you go.
And I had 2 hours each of REM and deep, so good restorative sleep. I don't need long sleep, just restorative, and I try to focus on that.
Yeah, that's good. I had a dinner a little bit too late last night, and I checked my sleep score on my Oura ring, and not good.
Yes.
I was in the 70s, and I talk about being nerdy, but my wife and I, we compare our sleep scores, and we see who beats the other person. And I didn't fare too well last night of a late
Well,
dinner. Yeah.
and when you eat late in the day, people don't realize your body's going to always prioritize that digestion before your restorative sleep. So even while you're, quote, sleeping, it's still doing the digestive work, and you can't get into really good REM and deep sleep until all that digestion is over. And sometimes digestion can take, upwards of 4 to 6 hours.
Oh yeah, yeah, and I know the conventional way of thinking about it is like finish your dinner at least 4 hours before going to bed. But
Yes.
I don't think that's enough time for me anyway. I think that's kind of putting on the short end of it. Like I've got adjusted my way of eating where I obviously have my breakfast. I have like a kind of like a afternoon lunch, and that's it for me.
Yeah.
Because I mean I don't need it. Well, when you're following a ketogenic lifestyle, as you know, Jimmy, that you're naturally you're not going to be hungry, and you're just going to run off fat, and that's your energy, and that gives me enough time to digest my meals and get a good night's sleep. But last night, different story. So.
Oh yeah, yeah, and every once in a while it's no big deal, but you will feel
Sure.
it in your sleep. Scarlett, you're up next.
Hi, thank you for pulling me up.
Sure.
I was wondering if tamoxifen was also having an effect on glucose or on insulin.
Oh, yeah. Let's see, tamoxifen. Yeah. So how long have you been on that medicine?
5 months.
5 months. Okay. So you just recently
I've been
started.
doing keto for 5 years, something like that.
Okay.
And this medicine.
What have you know? Like, so if you've been doing keto for 5 years, do you normally check your glucose and your ketone levels?
Not all the time.
Okay.
Sometimes more low carb, sometimes more keto.
Okay, so I'm wondering, have you noticed any? Have you started to kind of check your glucose and ketones since starting the tamoxifen?
Yes, I think it's been less ketones than before.
Okay, and you haven't adjusted anything at all as far as your eating?
No, not really.
Okay. And what about your glucose level? Did you check that too?
No, I didn't.
Okay. Yeah, I'm curious. I haven't heard much as far as the ketones or the glucose being affected by the tamoxifen. And by the way, I know there's some doctors in this room. If they can chime in, if they wanted to raise their hand and comment, love to hear what they have to say too. I haven't heard too much about the effectiveness of or in terms of the glucose and the ketones being affected by the tamoxifen. I haven't heard that. But it's if you got the ability to check.
So
when you are checking your ketones, you said a little bit less. What are you coming in at, like approximately?
Sometimes not in ketosis, sometimes moderate. Oh no, not moderate, just a trace. And not much more than that. And I'm fasting and, doing a lot. During the weeks, 24 fasting, intermittent fasting.
So
and
Brian,
the weekends, 16/8 or something like that.
So Brian, Dr. Catherine just came up. You asked for a practitioner. What's up, Dr. Catherine?
Hi, I just wanted to mention, I do have one patient I can tell you that was on tamoxifen. Now, tamoxifen, if I recall, is an AstraZeneca medicine. So when they made the clinical trials, it was with the brand. And they used some fillers that some of my patients are very sensitive to with tamoxifen. It can cause a little fluid retention. So that's something to consider. So for my one patient, I compounded the tamoxifen, so we didn't have any fillers for her. And she tolerates it much better. She slept better with it. And we know when you sleep better, you tend to manage your weight better as well. So that was just one thought to offer. And you may be noticing some fluid retention.
Dr. Catherine,
yeah.
I was going to say thank you for that. That's a great point as far as the fillers. That's rarely discussed, and good for you for picking that out. That's awesome.
Well, she's a Hashimoto's patient too, so those are patients who are very sensitive to any of those contaminants. And there are some pharmacies that will get you the AstraZeneca brand, and that was our backup option if she didn't feel better with the compounded formulation.
Great catch.
Well, thank you. Thank you.
Yeah, I know. I'm sorry. Go ahead, Scarlett.
I did feel some water retention, but I did notice that in the ankles and calves.
Yeah, that might be the issue. So when you're getting on the scale and you're measuring, it's probably that you have that fluid retention and edema. So it is water weight, and you can't really fast that off when it's a hormone issue. A selective estrogen receptor modulator, that is the tamoxifen.
Yeah. Great, thank you.
Thank you, Scarlett. And speaking of fillers, thank you for bringing that up, because that was something I wanted to ask Brian about. Because Armour, a few years back, they added all these fillers and they changed this formulation, and suddenly all these Hashimoto's and other hypothyroid patients were going, what the hell? Things are out of whack now. Did you notice that, Catherine, when that change was made to the formulation?
Absolutely. I'm not a fan of Armour because it's so variable and the way they source it changes. So sensitive patients don't do well.
Yeah.
So I'd rather they're doing a Tirosint or brand Synthroid. And so then we know, and then we can always add the Cytomel or Liosirinin if needed.
Yes.
Sure.
And the Armour is just desiccated pig thyroid. That freaks out people, Brian, when they find out like what some of these drugs are. They're like, it's desiccated. What? It's what?
Yeah, exactly. And I just thinking off the top of my head of Premarin. I mean, that horse's urine. So that's like, what am I taking again?
Oh, yummy. Triple J, would you?
Exactly. Yeah.
Triple J, would you have horse's urine?
No, I don't think I have that. No, that is something I cannot co-sign on, sir.
Yes, I hear. Although if it normalized your weight and your blood sugar, would you still do it? I'm making him think about it.
I'll stick with keto.
You go, boy. What you got for us today, man?
Listen, I was listening to, and I know, Jimmy, you probably know my backstory and
Yep.
everything. But I was looking at some of the medications I have, and I've been doing keto now for, I guess, almost a month, 27 days. And my blood sugar did come under normalization, like my first week of keto. So I was scared at first to take my medication because I thought that, hey, I'm already getting it lowered by eating right, so I don't want to take the medicine and then get it, it become even lower. But I heard you guys say about the metformin that I still can take it. It's 1,000 milligrams. You were saying that I probably can still take that and it can go good with my keto. But I also have here Januvia and Jardiance, atorvastatin.
That's the statin.
Let's see, Glypiride. Yes, sir. Telmisartan. I think I got Glypiride and metoprolol.
Wow.
Those are all the medications that I have right now.
So
I had stopped taking all. Oh, I'm sorry.
Oh, you took yourself off of all of them?
I did because my blood sugar was in range. So I was like, I just stopped taking them. But if I need to go back to the metformin, I can. But I had to stop taking them after my second week on keto because my level, my blood sugar had come down dramatically.
Yeah.
Yep. So first of all, congratulations. I mean, that's awesome. I hope people are listening to this because this is what can happen when you change your lifestyle and start eating well. But yeah, I think metformin is, if you have to go back on something like that, metformin would be my first choice. But I'm glad that you got off, especially that Jardiance, like I said earlier in the conversation, I'm not sure if you've heard about that, but that's something that can really put you into some trouble. And, when we're talking about starting a ketogenic lifestyle, we've got to make sure that, those medications, the Jardiance, the Farxiga, Invokana, we gotta stop those. But yeah, I think the metformin, I think that's a gold standard, really. I mean, in terms of increasing insulin sensitivity and I think that if you happen to go back on the diabetes medication, that would be the one to go back to if you have to. But just curious, can you give me some numbers as far as like how your blood sugar is doing since being off the medications and adjusting your lifestyle?
Sure. I'm going into it now. I use the Live on the Go.
Live on Go.
Yeah, I
Yep.
use it, and I go to my all logs. They've been ranging like 128, 119, 123. You know, like before breakfast and stuff. Like if I have, it hasn't gone over 133.
After eating? Eating,
but,
Triple J?
Now that 133 was like before lunch though. I had ate breakfast.
Okay.
But it went back down afterwards to like 119 after lunch.
Okay.
So I'm staying in the ranges. It says blue, you know what I'm saying, beside the numbers.
What were you before you went keto and were on all those medications? What were your blood sugars like?
Man, like in the 200s, 240.
Wow.
Sometimes, especially when I wasn't eating right, man, it'd be 300 or whatever.
Wow.
And so it was in the twos, and when I started keto, it dropped dramatically. So I was scared to take the medicine because in my mind, I was like, well, if I keep taking the medicine combined with me eating right, something bad's going to happen.
Triple J, you are so intelligent, man. You are so intelligent because, Catherine, I'm sure you see patients that obviously you're teaching them along the way, but there's a lot of patients that would just eat the diet and not even realize it could have such a powerful effect that they need to come off of medications.
Correct. So there's a great opportunity, and just as you did for yourself, Triple J, to be prescribed once you start seeing the benefits of keto, which is really lowering your insulin level by diet. Now, I want to just bring something up, Triple J, and that is that the medication regimen that you were on, you know, a lot of that was to be protective of your blood pressure, and that's very important for your kidney function. So as a precisionist, I'd be, you know, probably in favor of keeping you on metformin, keeping you really well hydrated, having you continue to make advances with the ketogenic diet, and being really aggressive about keeping your blood pressure in range and looking at your collective cardiovascular risk, because I suspect for you, you know, it's awesome that your sugars went from the 200s to the 100s, but I would push you towards even more optimal range. And that comes with time. And we're also probably looking at some genetics and, you know, lifestyle can only go so far, and we can really leverage the benefit of some of these medication, which will give you better organ protection when we speak of kidneys. And keep in mind, too, that really the data for metformin that really anchored towards the TAME trial, which is using metformin for healthy people prospectively in clinical trials now, Mears Barzilai's work. That data comes from looking at diabetics, type 2 diabetics, and appreciating that they had much lower rates of cardiovascular disease and cancer when taking metformin. So that's why we see metformin used in some of the longevity spheres, or berberine, which works in a similar pathway. Plus exercise is really, you know, what you're getting there is upregulating that cyclic AMP kinase pathway that metformin does.
Triple
Great
J?
point, Dr. Catherine.
Triple J, any comments?
No, I was just listening, soaking it in. So I put my metformin back over here on the side so I can know I can take it. And these others, I guess, I know you got to keep going, but these others I can ask about later in the DM.
Oh, go ahead. Like yeah, go ahead and ask about.
Sure that I'm doing what's right.
Yeah, go ahead and ask about them. I'm sure Rhonda and Malika don't mind.
Triple J.
Oh, Brian has something to say. What you got, Brian?
I'm sorry. I just wanted to say that first of all, Triple J. I wanted to say that keep going. You know, keep doing what you're doing. I mean, I think you're. You know, like Dr. Catherine said. You know, it's going to take time, but you are heading in the right direction. So don't give up. You're doing the right thing. I just wanted to kind of chime in on that.
Yes, sir. Thank you. I know, and I got confused when there was all prescribed because it was just so many they hit me at. But you said I know you said the Januvia is going to be a no right now with what I'm doing. Jardiance. I'm sorry. So the ones I have left now, I guess, is that the metoprolol, the glypiride, the atorvastatin,
the statin, yeah.
Yeah. The statin, yeah, yes, sir. So this statin is you said is kind of bad too, right?
Well, it's basically what we were talking about earlier with the cholesterol-lowering medications, Lipitor, Crestor. They're now generic. So atorvastatin, is that Lipitor, Brian?
Yeah.
So, yeah. So, what benefit are you getting from that, Catherine? Would you concur that there's really probably little to no benefit unless he has some genetic predisposition like familial hypercholesterolemia or some other reason why he would need to be on a statin?
Well, the data is that the statins are protective in secondary prevention of coronary disease, not primary prevention. So
Okay.
Triple J, that means that if you have a coronary calcium score that shows cardiovascular disease, it's probably more protective of you to be on a statin. Likely. Now that depends. It depends on how well your blood sugar, blood pressure.
Yeah.
Assuming you're not a smoker, we wouldn't want you smoking. And then the choice of the statin is one where many people, especially from a blood sugar perspective, they do better on a water-soluble statin. So the atorvastatin or Lipitor is a fat-soluble statin. So that can sometimes have a little more side effect for people than
Yes.
others. So I think there's some opportunity to really hone in and leverage why statins are successful is they work as anti-inflammatories for people in very low dose in some cases. So what's that sweet spot for you? First, is it primary or secondary prevention? Because I know whenever I put somebody on metformin, the drug companies or the insurance companies send me a letter saying my patients should be on a statin also. But I risk stratify my patients based on, do they have coronary disease? Would they leverage any benefit from statin? If we're choosing a statin, we're choosing one that will be as safe as possible, causing the least adverse effects. And that actually is related a lot to your genetics when it comes to how your body metabolizes those medications.
And Dr. Catherine, I just want to say too, real quick, that you touched on another great point about the lipophilic versus the hydrophilic statins. The atorvastatin, that crosses the blood-brain barrier, and that also can contribute to memory loss and effects in that realm. But when we're talking about the ones that don't, the rosuvastatin, which is the Crestor, that's kind of like, if somebody has to be on a statin, that's kind of like my go-to statin. Do you have any thoughts on that?
Yes, I tend to use pitavastatin or rosuvastatin. And some of my patients are, if they need to be on a statin, we are having them take it as maybe the lowest dose, even every other day, so that we can really hit the targets that their lipidologists are looking for while keeping those adverse effects in check. So it takes a little bit of, testing, retesting, and then you got to do the lifestyle stuff too. So, appreciate which diet works best for your cholesterol metabolism. And then don't forget too, really, cholesterol is usually related to hormone balance. So, your doctor should be checking your thyroid levels. Testosterone is very cardioprotective in men who are deficient. And when there's a lot of inflammation in the system, we do see that testosterone levels can be less than optimal. So there's a lot of nuance that goes into this. But Triple J, the point is you've made such outstanding progress with your metabolic health, and it really has changed the trajectory of your health outcomes. And getting to learn more about what's driving your blood pressure, what's driving your risk of heart disease, why they're giving you about, and get really dialed in.
Thank you, Catherine. Triple J, thank you so much for asking your questions. And yeah, dude, like everybody else has said, keep it up. And the main thing is you are lowering that inflammation that would put you at risk for cardiovascular or other issues related to your diabetes and the insulin resistance you're dealing with. you're doing a good job. And so thank you for your highly intelligent questions. Rhonda, you're up next.
Hi, guys.
Hey.
Okay, I'm up next to go get some blood work, but my question is, how do I go about talking to my doctor about coming off atorvastatin 20 milligrams? At what point when I get this blood work back, am I to, go to her for my checkup, which is in 2 weeks, to say, can you consider taking me off? My mother did have a stroke and passed away. My blood pressure and cholesterol and all of that were borderline everything before, but now I am doing keto pretty well. So I'm just wondering, at what point, or how do you discuss it? Do you say, I'm at this level and I'm doing these things, can you reduce it, or what do you say?
Well, let me ask you this. Thank you very much for your question. Do you have any history of heart attack or stroke, or I just want to make sure that did the doctor put this on for primary prevention?
I do not. Okay. But my cholesterol was high initially.
What does high mean? Because high to a doctor is different than actual high. What'd you say?
I'm trying to get to my chart.
Oh, you're okay. It's just good to define high, because some people tell me, Jimmy, I have really, really high cholesterol. What is it? 230?
Is that the lipid panel?
The lipid panel.
Yes.
Okay. So right now it's sitting at 198.
Your total cholesterol? Hold on. Total cholesterol is 198?
Yeah, the last time I tested with triglycerides at 228.
Okay, but you think 198 is really, really high?
Well, that's better than it was before. I've been doing a little bit more before I did keto, but now I'm going in for more testing today.
So go ahead and do the breakdown. I'm sorry, Brian. Go ahead and do the breakdown. Do you have the triglycerides and the HDL and all that there?
Yes. So the triglycerides were 228.
Okay, that's high.
The HDL was 52.
That's not bad.
The LDL was 100.
Out of context.
And the non-HDL.
Yeah, that's just total. That's just total minus HDL. Okay, so you're getting new blood work. Rhonda, I would love to see how well you have progressed. And how long have you been keto?
Since December 7th.
Okay, so yeah, you're going to see dramatic changes. I would be shocked, Catherine, if her triglycerides are still above 200. They should have plummeted definitely closer to 100, if not below.
Yeah, if those are your numbers on a statin, I suspect you have a familial component. And what the next step would be to add a fish oil. So the prescription is called Visipa, but you could also take a high quality fish oil, and that often brings down the triglycerides. But fasting is really very effective for bringing down those triglycerides as well.
And I've been doing the fasting, till like 12 or 1 o'clock each day. But I've been concerned if I'm slowing down progress in regards to weight loss, which I know health is more important, by doing it every day, if I need to mix it up.
Well, you could join. Go ahead, Brian.
Oh, I'm sorry. When was the date that those labs were drawn?
These were drawn, let me look. These were drawn, oh my gosh, 8/21/2018.
Okay, that's been a while ago. Okay.
Yeah, so it's kind of out of context right now.
Yes.
That's over
3 years ago.
2 years ago.
Yeah.
Yeah. Was that your last blood work drawn?
Well, I had some other blood. Yeah, that's all I have for the
cholesterol
lipid panel.
Yeah.
Well, no, it said collected on 11/5/20. resulted on 11/5/20. I was reading something else.
Okay,
so
that makes sense.
Okay, so this is before you started ketogenic, your ketogenic lifestyle, because you said December 7th, right?
Yes.
Okay, so Dr. Catherine, my thoughts are this, and please correct me if I'm wrong, but I would like Jimmy said, I would expect to see the triglycerides. If you're following a ketogenic lifestyle, those triglycerides are going to go low. In terms of getting back into the normal range, because in the 200s is quite high. Would you wait? I would. My thoughts would be wait. Get blood work drawn again, see where the triglycerides are at now, and before going to Vasipa, which it's a high quality fish oil, obviously. But before I would do that, I would probably just stick with the diet a little bit longer before going on Vasipa. Dr. Catherine, what are your thoughts?
Well, I want to answer your question, RC, and that is, how do you approach walking into your doctor this week to let them know you've made some changes? And so I think what we need now is to repeat that lipid panel, repeat your metabolic panel, which includes your blood sugar, your liver function test, and that way your doctor can work with you on identifying how have you responded to these dietary changes, and then is there an opportunity to take you off the medication, maybe do some imaging to see if you actually have heart disease, what the goal of the statin therapy is. So I think it's wonderful that you're asking this question and you're thinking about how you can change your diet and lifestyle to use as little drug as possible. And I suspect your doctor will be receptive to that conversation. And you just need, I think, a new set of data. But I will say this, the fish oil is really, it does lower visceral fat. So even when you're fasting and you're trying to lose weight, if you can eat more omega-3s, that's really an anti-inflammatory strategy. And we do see changes both in the triglyceride levels, but also in body composition data.
Okay. Thank you.
Thank you.
The Vasipa, is that a prescription drug or something I get over the counter?
It's a prescription.
So I would have to talk to her about that too. Okay.
Yeah, and by the way, it's not cheap. But actually, now that I think it became off patent. I think.
Correct. It's generic now.
Yeah, generic now. Yeah. Okay.
It's still hard to get it approved, and they have coupons and stuff. But if you are looking, for anyone who's listening, if you are looking to get a fish oil supplement, make sure it has an International Fish Oil Society label on it, IFOS, because how you source fish oil is really important. It is expensive, either prescription or out of pocket. And I think in your case, though, RC, just seeing where your levels are. I like to see triglyceride. I'm pretty aggressive, less than 80, but some people will never get that no matter how long they fast. And that's genetic. And I'm actually one of those people. It's really hard for me to get my triglycerides lower.
Yes.
And so there are many factors that go into looking at your labs. But I think it's awesome that you've got some goals with your doctor.
Yeah, and my favorite fish oil, especially my favorite fish oil supplement is salmon. just to eat the salmon. I'm all about trying to get as much as you can for your diet. Incorporate that wild caught salmon in your diet. At least a couple times a week. And yeah, so
I wish I liked salmon, but I may have to just force it down my throat.
Don't do that.
Yeah. Thank you guys so much.
Rhonda, thank you. And that condition that Catherine was talking about, that's called hypertriglyceridemia. It's just a big fancy schmancy word for, I got high triglycerides. Dr. David Diamond, are you familiar with his work, Catherine? He also has hypertriglyceridemia and has done some protocols to help with that.
Yeah, I think I've seen some of it. And, really in my practice as a precisionist, we're going to be looking at lipid panels at least every 12 weeks. Sometimes we'll do a challenge where we change the diet and then look at around 4 to 6 weeks to see what levers are really giving us the most impact.
Yes, and that's usually when you see that people are carbohydrate restricting well. It usually shows up in triglycerides and blood sugar extremely fast.
Yeah, I've got a lot of biomarkers I like to look at when it comes to that, and those are certainly in the top category.
Yes. All right, Malika, you are our last caller today. What you got for us, sweetie? Uh-oh. She's like, I got nothing for you. Oh, she's back. I think she's having connection. Malika, what you got?
Yeah, sorry, I hit leave quietly instead of the microphone.
Oh, that's funny.
But I am on a few minutes. I'm starting keto tomorrow. Literally, like my food is here.
You better. I'm gonna hold you to it, Malika. I'm gonna call you out.
Cutting up of my, my ingredients and stuff. Just make sure I have everything ready, for tomorrow. But I'm currently on metformin, which I've already heard on a few of these rooms that I will probably stay on that. It may get reduced to level at one point, but right now I'll continue with metformin. But the one I'm curious about is I'm on Victoza, and I am on Glimepiride, Glimepiride.
Glimepiride, yeah.
Glimepiride, okay. And I do take atorvastatin and lisinopril. That is my, and I'm joining keto to get off of this medication. Well, some of it, at least, but I also take for supplements, I take a vitamin supplement for a diabetes health pack. That, you just get from the over-the-counter. It's just the vitamins that, according to somebody, diabetics should take, including the fish oil is in there. So with me starting keto tomorrow, before my doctor already told me to also take insulin. She told me the first thing to reduce or take away is the insulin. And then if it feels like, and then we'll look at the Glimepiride, whatever that one is. So I was wondering what your opinion of that is.
Yeah, I think that's a good approach, and that's what I would be looking at. The same thing, reducing the insulin first, and then Glimepiride second. So those are the two right away that I would be looking at. But the insulin number one, and just make sure your doctor is on board, because there's going to be some. Make sure you have a constant contact with your doctor, either on the
phone. Oh yeah, that's what she said. Yeah, that's what she said.
Yep.
Constant contact.
Yep. Because this is a very delicate switch here, and we don't want you to get into the hypoglycemia, any of those hypoglycemia episodes. And what your doctor said, I think is the way to go to approach this.
Catherine?
Yeah, she was saying to check for the 5 times a day my sugar, and I have that record ready when I call her. But I'm starting tomorrow. I'm getting blood work Monday, just so we have where I am. But before I even start, right before, I really start, and then we'll take it from there. But for now, that is what I'm on.
I think it's a good idea to get that blood work at the beginning, just because when you talk about progress, and obviously we're with the ketogenic lifestyle, most people think about weight loss, but I look at it as more of improving metabolic health, and
that's how I'm looking at it. For me, that'll be a byproduct. You know what I mean?
Yep.
But
weight loss is a side effect. I look at that as a side effect. It's a great side effect. But the idea of improving metabolic health is the way to go, and what better way to do that is to take before and after blood work and see how well you've improved.
Catherine, any comments?
Thank you.
Thank you, Malika.
Malika, I just want to say I think it's awesome that you're getting labs done, you're seeing your doctor, you're looking into modifying your diet to reduce your glucose levels and improve your health. I would ask your doctor for a continuous glucose monitor.
Yes.
Because I think this is really helpful for you to get really dialed in, get off those meds. And that concern that so many conventionally trained physicians have about you becoming hypoglycemic is a valid concern. But when you're wearing that CGM, you don't have to stick yourself every, 4 or 5 times a day. You can actually see real time what your blood sugar is. So you put a sensor on your arm, and as an insulin-dependent diabetic, you might even have the option of a Dexcom, which is a 90-day sensor. But your insurance should cover those, and even if you have to pay a little bit out of pocket, that data is so important.
It's so worth it.
Yeah,
Yes.
and I think that's the best way to figure out what foods work best for you as well, how your stress, your exercise, your sleep, your hydration, and what meds are giving you the best impact too.
And Malika, that's called Freestyle Libre. So when you go to see the doctor on Monday, say, hey, can you prescribe me a Freestyle Libre? And because you're already a type 2 diabetic, it should be a no-brainer. They have what's called an ICD code that they can hopefully get your insurance to pay for that way. Right, Catherine?
Yeah, especially if you're an insulin-dependent diabetic, they'll cover that. So, and if your doctor's not comfortable with that, then I would maybe see an endocrinologist because they have more experience.
That's actually who I'm going.
Oh.
I'm going to see her in a few weeks. She's the one that.
Yeah.
Yeah, I see
She'll
her more
probably
than any other doctor. I see her like every 3 to 4 months. I'm supposed to.
Yeah. They might even have some samples at the office.
Go ahead, Brian.
I was going to say too. Oh, I'm sorry. I didn't mean to interrupt. I apologize. I'm trying to get a word here, but yeah. If in a perfect world, the Freestyle Libre or the Dexcom, especially in patients that are on insulin, this should be a standard level of care where we put everybody on a CGM. Even people that aren't on insulin, the amount of data that comes out of those CGMs are amazing.
Yes.
And so insightful. So in a perfect world, I wish that, it's kind of getting that way now where more people are getting on them. But even, I did it myself because I was curious, just because I don't have diabetes, but, it's so interesting to me to see what happens when you take eat a certain food and you see what responses you have. But I love that thought you had there, Dr. Catherine, about the CGM. Super, super important.
Or even just the impact of stress on the body. I know when I was wearing one the last time, I got a distressful call, and in the midst of the call, I was like, something's happening to my blood sugar, and it jumped 30 points within 15 minutes just from a distressful call.
Yeah, that's pretty. Yeah, exactly. So when we go back to the whole ketogenic lifestyle, not just diet, but stress, everything plays a role here in terms of sleeping, stress reduction, like I said before, diet, vitamin D and exercise, all of that plays in a role.
Yes. So Malika, I'm putting a CGM on my arm tomorrow in preparation for this 1 week fast that I'll be leading. So I feel it. And definitely you will love that. It'll be such good data. And even Triple J down the audience and anyone listening right now, definitely highly recommend a CGM. But Malika, thank you for that. And Sarah, you're our very last caller. What you got for us?
Oh, I was just going to make a plug for the CGM. I have a Dexcom, and it's fantastic. Like you said, you can see your stress. You can see what happens when you eat anything. You can see the impact of exercise on your blood glucose.
Yes.
And I know you mentioned the Freestyle Libre. If you are able to get a CGM, Dexcom is going to be a much more accurate CGM than Freestyle, but the Freestyle is a lot cheaper. And so if your insurance won't cover the Dexcom, the Freestyle is going to help, of course.
So what's that number? Is it 6 now? What's the version?
Yeah, well, I have the 6. I think they're still selling into 5s as well.
Yeah. The 6, though, has like a lot of bells and whistles that the earlier models did not. I think when I tried the Dexcom, it was the 4, and I hated it. I couldn't get it to do nothing accurate, and I had to keep doing like finger prick tests, and I'm going, wait a minute, the purpose of this so I don't have to prick my finger.
Yeah, so 6, you do not have to calibrate it.
Yes.
Which means no finger sticks at all. The first 24 hours, it will be off. Like, you don't rely on it.
Right.
But after 24 hours, extremely accurate. The other thing is, unlike the 4 and the 5, where it was slightly uncomfortable or even you could say maybe painful to insert it,
Yes.
the 6 is like nothing. I mean, you press a button and there's no pain associated with inserting it. It's very easy to use. And you don't need to pay for an expensive receiver, because if you have a smartphone, you can set it up so your phone is your receiver.
Sarah, you're convincing me I may need to try Dexcom again, because I do these long experiments that a 14-day period, Brian, just ain't going to cut it. So I don't want to keep having to pop it back and forth between the arms.
That's right. Yeah, but no, and just to kind of dovetail off of what Sarah just said, the Freestyle Libre, and I did some experiments with that too, because I would do the finger prick and also would see, like in terms of fasting, before I had my breakfast. So it would give enough time to have my body, equalize as far as the finger prick and versus the Freestyle Libre. And yeah, it's a little bit off, but you get to see a general trend with the Freestyle. It's not, the Dexcom is definitely better. It's like kind of like a Cadillac version of the CGMs. But, if your insurance doesn't cover it, definitely get the Freestyle Libre, because you can definitely see the general trends and how your body's responding to certain situations.
See, we need a keto analogy. It's the ribeye, the Dexcom, and the Freestyle Libre is the flank steak or the sirloin steaks.
There you go. I love it, Jimmy. That's great. That's awesome.
Got to keep it 100 here. Sarah, thank you for that added information. And guys, I hope this was educational for you here today, talking about keto and meds. And we had a very nice pop-up surprise guest moderator, Dr. Katherine Johnson. Go check her out. Definitely go follow everyone on stage. And I appreciate you guys being here today, Brian and Katherine.
Jimmy, thank you very much for having me.
Thank you, guys.
Dr. Katherine, thank you so much for she's gone.
She's still here.
But I wanted to say thank you, Dr. Katherine, for coming on here. She had really, really good insights and helped us out a lot. And Jimmy, thank you very much for having this discussion. I think it's very important, and I appreciate having me on.
Yeah, man. Like, this is a topic nobody talks about when people go keto. Your med needs change, and you may not need them, or you may still need them, but in lesser amounts. So I'm glad we kind of got that out here today. Guys, go join the Keto for the Soul Room. Click on that little green house at the top of the page. Definitely subscribe. I'm in these rooms all day long. I usually get pulled up to a stage. So if I pop in a room, there's no hiding. I can't hide. They always pull me up. So occupational hazard, Brian. But guys, what I do here is interview people. And so if you go to my bio, you will see my upcoming recording schedule all next week. I'm going to be doing a guided fast, 7-day fasting challenge from March 1st through the 7th. And so at 1:30 p.m. Eastern time, all this next week, starting Monday through next Sunday, I will be coming on here to give you support, answer questions about fasting. So definitely come back and keep checking my bio for updates for new guests that will be coming up. But thank you for spending your time with us here today, and we'll see you around the clubhouse.